Hello, I'm Monte Bobele. I'm an American psychologist who has been working in the area of brief therapy almost my entire career. I'm an emeritus professor at Our Lady of the Lake University. That's in San Antonio, Texas, and that's where I spent most of my career. And the reason I'm talking to you today is because I developed an interest in single session therapy, and more specifically even walk-in therapy, going on 35 years ago, and maybe later I can tell that story of how that happened. And so I hope the video that you're about to watch is informative and you learn something about single session walk-in therapy.
I think then we move on to the questions or
Okay.
propositions or myths about the walk-in therapy or single session therapy. So first of all, it's a great honor to have you here in Finland. So it's a privilege for us.
Well, it's a privilege for me to be here.
Okay,
I've
that's
been
nice.
looking forward to this all year since the invitation arrived.
Yeah. We call you here in Finland as a father of the walk-in therapy. How does it sound for you?
I really think my colleague Arnie Slive is the father of walk-in therapy. I might be kind of like the stepfather.
Okay, that's okay also. So,
Yeah, because Arnie actually invented walk-in therapy in Calgary in 1990 when they opened the first walk-in therapy clinic there.
but maybe
And
you...
I came to it 2 or 3 years later after I
Okay.
met Arnie.
Okay. How would you describe or clarify to us that what there's in common or differences between single session therapy or for example, once at a time method of therapy?
Yeah. Single session therapies had a branding problem almost from the beginning. There's a story that Moshe Talman tells that his original title for the book that was called Single Session Therapy, published in 1990, wasn't single session therapy. He didn't want to call it that. He had another name for it, and I don't recall at the moment what that was. But the book editors said, no, we need to call it single session therapy because that sounds exciting.
Okay.
That sounds interesting. That sounds intriguing. Now, they had been calling their work single session therapy in the clinic where they were doing the research and developing the method. But he didn't want that name because he recognized that it would be misleading. But if he wanted to get his book published, he had to say yes to that title. And it stuck. And we've continued to use it in English now for the last 40,
Yeah.
what's it been now? 35 years
35
since the
years, yeah.
book was published. And strangely enough, single session therapy was never meant to mean one and only. So it didn't mean a unique experience. It didn't mean a one and only time. But there was such a vast literature, and I know in the last 10 years or so, maybe 15, people in the single session therapy field have wrestled with maybe we should call it something else. And a number of years ago, Arnie and I started talking about it being one session at a time, and we talked about it that way for a little while. Michael Hoyt started talking about maybe we could call this one at a time therapy because then it doesn't sound like it's one and only.
Mm-hmm.
And so for a while we talked about one at a time and used that more and more. The problem with the one at a time, there's at least two problems with it. One is that if you're a psychologist in Finland and you want to know about one at a time therapy and you go to the databases, you won't find anything published on one at a time therapy except for 3 book chapters that were written by some folks who have adopted that as a model, a way of thinking, one at a time, thinking for their entire organization. And so they've stuck with it. And when they published stuff, they called it one at a time, OOAT.
Yeah.
Nowhere else will you find it in the literature. So to some extent, it's tough to give up single session therapy for the one at a time name. And so the answer to the question is, one at a time is, in my opinion, synonymous with, it means the same thing as single session therapy if it's one at a time therapy. It's been a bit of a branding problem. We want to get away from the idea that it's only one session, but we've just not been able to get there. And one at a time has its own problems.
But anyway, maybe we can jump to the questions or proposition or myths about walking therapy. How'd you answer if I said that one session of therapy can't help anyone?
Well, it seems almost impossible. If we've gone to graduate training programs as psychotherapists and we've been taught that change is something that happens very slow and over a long period of time and takes a lot of deep and hard work, and you shouldn't expect change too quickly. But in fact, there's a lot of evidence that one session can help many people. In the history of mankind, we find many instances of rather significant changes happening almost overnight in people's lives. There's been some research in that area. A New Mexican psychologist a number of years ago published a book called Quantum Change, where he described a series of interviews that he had with people who had made rather significant changes in their lives in a single session. When I do workshops, I frequently ask psychotherapists, how many of you had a situation where you met with a client one time, and at the end you've been planning to see them for several sessions, and at the end of that session the client said, well, this was really helpful. I don't think I need to come back. And you think, yeah, I agree, you've made a lot of progress. And almost everybody in the audience will raise their hand and say, yeah, that's happened to me. And I say, so you're already doing single session therapy by accident.
Yeah.
Would you like to get better at it? Yeah. Follow-up studies have been done over the last 30 or 40 years. People that have come to a walk-in single session therapy clinic, and people retrospectively, months, years later, report that the session had been helpful to them.
So in your opinion, what could be the best result for the client to have from one session therapy or one session? What could be the best hope?
Well, I think one of the things that I'm real modest about is what I expect to happen in a single session. So I'm really careful to say that one session, excuse me, let me put it this way. Most people find one session to have been a helpful experience for them. What I'm absolutely sure of is one session doesn't cure a schizophrenia or anxiety or depression or any of those diseases or categories of problems. But if you ask people if it had been helpful, almost anywhere from 70 to 80% of people will say that it had been helpful to them. So I think that what happens in one session is that you can get people started toward a change, people that have felt hopeless or stuck or felt like nothing could ever happen differently in their lives. If we can just get them moving, just get them unstuck a little bit, then they feel more empowered, they feel stronger, they feel more confident that they can do things. And that's what I hope to accomplish there.
Okay.
Maybe this is a question that'll come up, but we have for many years been asking people early in the session, what's gotten better for you since you decided to come here today? That's an old solution-focused question from dating back from Michelle Weiner Davis years ago. And people almost always can point to something that's gotten better, even if they're walking in. And I say, what's gotten better for you since 9 o'clock this morning when you decided to walk in here? And people report things like, well, I feel like I've decided to make a change in my life. I've taken the first step toward making a change in my life. And then it's really easy for me to say, okay, what's the next step going to be? And so if I think of people already being in the process of change when they arrive in the office, then all I have to do is keep them moving in the direction they've already taken.
Yeah, it's super interesting. Maybe you kind of answer to the next question, but I still going to make it. Is it so that kind of walk-in therapy is only intended for smaller superficial problems?
Yeah, that would seem to be the case. People would think that was the case. And indeed, if it's a small, simple problem, usually people solve it on their own. So people rarely come to therapy for a small, simple problem. In my experience, problems aren't small or simple or not big or little. People can come in with a really, really big problem, but improvement for that person is accomplished by them taking a small step towards something. So it's not for superficial problems. So we've seen in my career, I've seen people that are carrying along with them some medical diagnosis like schizophrenia or borderline personality disorder, all of those big diagnoses that allegedly require years of treatment along with medication, benefit from a single session. What does that mean? Does that mean that they're not clinically depressed when they leave? Does that mean they don't have, they're not hearing voices when they leave? Well, no, maybe not. But what they are doing is they're on the way toward being able to cope with and be successful in life in spite of those things.
Exactly. Yeah.
And so I don't think I don't even rule out seeing people for single session therapy that are referred with these really, really big problems.
Let's get a little bit deeper and one question more about that theme. What do you think that people sometimes say that single session therapy or walk-in therapy is just a band-aid solution for people?
Yeah, I've heard that.
Me too.
Yeah. In fact, Arnie and I used to hear that at workshops a lot. People would say, this is just a Band-Aid, implying that people needed surgery, perhaps, I guess, instead of a Band-Aid. And so Arnie did some very high-level professional research. He went to Dr. Wikipedia. And what Wikipedia said is that the idea about bandages in the treatment of wounds has been around since the time of the pharaohs in Egypt, 5,000 years ago. And the medical consensus is that the reason bandages have been so rigorous in the treatment of wounds is that they accomplish several things. One is that they prevent infection. So if you have a wound and you cover it up with a Band-Aid, you keep germs and other bad things from making it worse. Bandages can prevent the spread of infection. So if you have a wound covered up with a Band-Aid, you prevent that wound from affecting other people in the environment. Maybe protects the family and the friends and the person around that. And the third advantage that bandages have is they promote healing. They make things get better quicker. Okay. Now let's sit back and think about it. If we're a mental health professional, what are three things that are important to us? Well, we want to keep things from getting worse. So if we can prevent the infection from getting, if we can prevent the problem from getting worse, that's good. If we can prevent it from affecting other people in the environment, that's helpful. And if we can promote healing, isn't that what we're all about, is promoting mental health healing? So when I'm accused now of only providing a Band-Aid, I say thank you very much, because I'm promoting healing, preventing infection, and keeping things from getting worse. Malcolm Gladwell, a Canadian psychologist, wrote a book several years ago called The Tipping Point. And in presentations, I usually put a slide up with a picture of a Band-Aid and a quote from Gladwell's book where he says that Band-Aids are the ideal solution for most of the problems that people have, because they enable people that heretofore couldn't have gone out and played tennis or help their kids' soccer teams or cook dinner for their families, or a whole host of other things they couldn't have done without having the access to a Band-Aid. So I think that's, when people say, isn't this just a Band-Aid? I say, yeah. And
it's a good thing.
It's a good thing, yeah. It's not a bad thing.
Yeah. Let's talk something about the professional, about the, how to treat mental health, because sometimes we heard and we get the feedback that the walk-in therapy or single session therapy is not the kind of professional therapy, because maybe it's only one session or something like that. How do you see that?
Well, that's an opinion.
Yeah, it is.
And it's not it's a popular opinion, because the idea that you could be helpful to someone in one session, and the idea that you could be helpful to someone without this rigorous pre-assessment procedures and psychological assessments and all of that kind of stuff, can be really threatening to a profession that's to professionals that have grown up with understanding that that's what makes them professionals, is that they have this special knowledge. But what we find is that we don't need all of that. One way I think about it is if you have let's say you have a runny nose and you go see your family doctor for that. They usually will give you something to, some little pill, and say, go try this and come back in a couple of weeks if it doesn't work. What they don't do is do a lot of x-rays. They don't give you a CAT scan. They don't give you MRIs and all that kind of stuff. They don't do all of that testing. They use good common sense. He's got a runny nose. It's probably a cold. We'll send him home with some aspirin and something to dry up his runny nose. And if it doesn't work, come back and see me in 2 weeks, and then we'll go do
Go further. Yeah.
We'll go further and we'll do all of the testing. And in mental health, we've done just the reverse. We've said we have to do the $1 million workup, so to speak. We've got to do all of this testing before we actually work with them.
Okay. So in your experience, is it somehow, could it be somehow harmful for the client if he goes or she goes to the long-term therapy and a single session or walk-in therapy at the same time?
No. I mean, the simple answer is it can't hurt. Or the simple answer is yes, it can hurt. Sometimes we see people who come in for single session therapy because they're long-term regular therapist is out of town and can't see them, and they're in a crisis. And so they'll call the walk-in clinic, or they'll come into our walk-in clinic, and they'll have kind of a crisis intervention session. There was a single session therapist in New York City a number of years ago that made a living every August. In New York, in the States, psychiatrists and psychotherapists have a practice of going on vacation during the month of August, and so that leaves their clients with nobody to talk to. And so this one single session therapist makes a business of seeing clients one time or two times during the month while their regular therapist is out of town. So it actually serves a purpose. I had a session a number of years ago with a woman. I didn't know, for some reason I overlooked this, but I didn't know at the beginning of the session that she was actually in psychotherapy with another person. And after I discovered that toward the end of the session, when I was talking with her about what she had found helpful in the session, and I said, so what are you going to tell your regular therapist about today's session? You will talk to her about this? And she said, yes. And she said, you know, these things we talked about today, I've never talked to her about. Maybe I should talk with her about it. So it actually gave her a way of being able to help her long-term therapist redirect her treatment.
Okay.
So I think seeing a single session therapist or coming to a walk-in therapist, if you have a regular therapist, can serve a purpose. You may have a regular family doctor, but in the middle of the night you need some kind of treatment, you go to an emergency room or something, and you don't wait till the next morning.
Okay, then we take a next myth. If I say to you that something has gone wrong, or you're not professional if the client returns later, so can we say that the first session was not impressive?
Oh. Well, I don't think that the goal of single session therapy is that the client never has to talk to a therapist ever again. That would be silly. So we welcome people coming back for another single session. So I don't think it's unsuccessful if they decide to come back. In fact, I always say at the beginning of a session, we're going to work really hard today, see if we can't help you with this thing that's going on. But you can always come back and we'll talk more at the end of the session and we'll make a decision about that then. But single session therapy is a misleading name because it implies, at least in English, it implies it's an only session. And none of us that do single session therapy think it's one and only session. We think it's one at a time. So you can come for a single session today. You might come back next year, next month, or a year from now. Now, in the original research that Moshe Talman did, he defined success in single session. One of the criteria for success was that they didn't consult with another therapist within a year. I think that's too stringent, but he was doing research, and so for research purposes, that was their definition of a successful case. But we see people, I've seen 3 generations of clients in our clinic. I saw a woman when she was in her 20s having a crisis about getting married. I saw her a few years later when she was having a crisis about getting a divorce. And finally I saw her when her granddaughter was having problems in school. And those were single sessions, and it didn't mean that the previous one had been unsuccessful. In fact, the reason they came back was they had been helped in the earlier session. So the reason they came back was because the single session had been successful.
Exactly.
So no, I don't think that it's a failure if they come back. That's perfectly normal.
Okay, let's make some practical question about the profession. Let's imagine that the client talks the whole time, and therapist maybe doesn't have the time to ask anything. Can this kind of sessions be kind of effective at all?
That's a really tricky question.
It is.
One question I would have is what kind of therapist lets the client organize the session in that way. So there are some therapists that they invite the client to talk the whole time, and so then they really aren't left with any time to intervene, so to speak. So I think that's an interesting question, but I think it's a problem with the therapist, not with the client. In my opinion, if the client is talking the whole time, the therapist doesn't have an opportunity to even ask what are you there for. What would let you know the session had been helpful? And so I might just say to the client that had been making very little room for me to talk,
Yeah.
and I just have to say, could I stop you here just for a moment? I hate to do that, but what are you hoping will be helpful about this session? I just need to get all of this out. And I'll say, great, I'm going to let you get it all out, but let me know at the end of the session how you know getting it all out had been helpful to you, and then they've set my goal for them. And then I might continue to interrupt them with, is this helping you get it all out? And so I would do that, but that's a really specific kind of problem client, what somebody might call a problem client. And that's one of those gotcha kinds of questions that they always ask single session therapists. What do you do if somebody doesn't talk at all in single session therapy? And I might say, well, what would you do in any therapy if they didn't talk at all?
Okay. So what do you think about that when we talk about the single session therapy or walk-in therapy? So is it ever necessary to set some kind of limits with the clients? For instance, if they attend about 20 times, how would we should approach of that?
Part of that is an administrative decision the agency would have to make. So for instance, in our clinic, we don't put the clinic at the university that I work at doesn't have a session limit. You can come for a walk-in session as many times as you would like to come. Now, practically, that might mean you may not be able to come more than once a week because it depends on when they have walk-in hours at that clinic. But what we might ask that client is, you have been coming every week or every couple of weeks for a walk-in session. I'm wondering if you're looking for maybe something that would be more regular, like where you could just schedule and see the same therapist instead of a different therapist every time. And they might say, oh, I didn't know that was possible. And then we could refer them somewhere else in the clinic where they could have ongoing therapy. Strangely enough, we've had some people say, no, I really like coming to the walk-in clinic because I talk to somebody different every time. And I really enjoy getting different points of view. If I saw one therapist, I'd just get their idea about what I needed to do. But this way, I get to talk with a lot of different therapists. So if we don't think it's being helpful to them, then we might say, you've come here for 15 or 20 times, and every time it sounds like the problem that you're dealing with isn't improving. Let's have a talk about what we need to be doing differently. Maybe coming and talking with somebody isn't enough. Maybe you might need to talk with your family doctor and see if there might be some other treatment options for you.
I see. In your experience, how you handle the situation when you clearly see that the client is not acting or being truthful?
Well, how do you know when somebody's being truthful?
I don't know. I'm asking you.
Well, I'm not sure what I would be looking for. That's a tough one. I'd have to think about that for a bit because
Do you need to recognize that? Do you need to kind of know that someone is lying to you or something like that? Is it necessary?
that's a really tough one. I'm going to assume that for the most part, if people are wanting help from me, they're going to be as honest with me as they can be.
Yeah.
Now, that may mean they're not as completely honest with me as someone would like for them to be. They might not tell me about family or friends, or they might not tell me about medication that they're taking or previous treatment or a lot of other sorts of things. But I only can work with what I have in front of me.
Exactly.
So what I do want to find is what kind of strengths and resources does the client have, and maybe rather than calling this lying, I could think of this as self-protection.
Mm-hmm.
That maybe they're going to be very careful about what parts of their lives they share with a total stranger. That might be good judgment on their part, that they're not going to be totally honest with me about everything. And so I will let them go at their pace and not try to pin them down on their falsehoods. But I might say, wow, so it sounds like you said this and you said this, and so you got these really different kinds of ideas that you're having to deal with. So I try to work with what's, as they say in Texas, I try to work with the hand that was dealt me, you know,
Exactly.
the cards that I get.
Yeah.
And again, I don't think most people are dishonest with therapists. I think, again, that's one of those edge cases. That,
They are there for a reason.
yeah.
Yeah. Exactly. So you might think that single session therapy could mean that the entire therapy takes place in just one session. Doesn't that put a lot of pressure to the client?
Oh, because the client says I only have an hour.
Yeah.
Well, on the other hand, when everybody knows we have an hour, or it could be an hour and a half, it could be 2 hours in some places, a single session. It could be 15 minutes. I've done 15-minute sessions. So when you know and I know that we have an hour, then the client isn't worried about what am I going to have to save for next week or the week after. The client knows if I need more, I can get more, so that takes the pressure off there. It takes the pressure off everybody. So when you tell a client up front, we have an hour, and if you need more sessions, we'll talk about that later, but let's see what we can get done today. I think everybody relaxes a little bit.
So how do you, Monte, answer if I said that single session cannot be effective because effectiveness requires a long therapy relationship?
According to who?
I don't know.
Whose idea is that?
Maybe it's a myth.
Well, I don't know if it's a myth, but I know that in studies where they have looked at the trajectory of change over sessions, one study that I think demonstrated that quite clearly showed a graph where they followed patients that were in long-term therapy for 2 years. Now, that to me sounded like an amazing task, just finding people that were in long-term therapy that would be in therapy for 2 years, but they did. And what was done was at the end of every session, there was some assessment of how much they had improved since the beginning. And they did that every session for 2 years. They had basically 200 visits over 2 years, 50 visits a year. Everybody took off 2 weeks for vacation. Yeah. But what the graph shows is that the largest amount of change happens between the first session and the second. The increase in improvement is really steep. then the increase in improvement from session 2 to 3 is still steep, but not as steep. By session 6, improvement begins to level off, and for 2 years there is no further change. Now, I would think that after session 6, you could have stopped right there because the patient didn't change any more. And in this interesting research, they also followed 100 patients who weren't in therapy. But every week they took the assessment as well about their improvement. And people that didn't get therapy during that 2-year period also improved. And they improved more slowly than the people in therapy and didn't improve as much as the people in therapy, but almost as much. So I don't think what's important is the length of time. I think that huge gap between session 1 and session 2, that huge improvement, says that most of the therapy really happens in session 1. Most of the change happens in session 1. So the rest of it is icing on the cake. Most people don't have 2 years to spend in therapy. So I think that there is a place for long-term therapy. There are some problems, not a lot, but a few problems that need very long and intensive relationships with a therapist. But most people, and I usually estimate 80% of what people come to psychotherapy for, can be handled rather briefly in 1 or 2 sessions.
So one more further question for that theme. Do you believe that you, as a professional, you have chance to build a trust during the one session?
Build trust.
Yeah.
Yes. Yeah. I think of it, in English, there are a couple of words that are frequently used, and one's a therapeutic relationship. And that there's talk that the therapist and the client have to develop a trusting relationship for improvement to happen. But I like the word alliance more than relationship, because alliance implies that we're going to be working together on something, not a relationship, but an alliance. So when I'm saying at the beginning of a single session is that you and I are going to work really hard today to see if we can't make this one session as effective as possible. That's different than a therapist that begins the first session with, I need to let you know that therapy is a long, slow process. Don't expect too much to happen right away. It's going to take a while for you to get to know me and for me to get to know you. And so, don't be too disappointed if you don't see any changes for a couple of months. That's 2 different ways of setting up the alliance. One is, don't be very hopeful about this. The other one is, be hopeful about this. Many people find once enough. You and I are going to work really hard to make that happen. That's an entirely different kind of thing, because I'm talking about what we're going to do together relatively quickly, rather than what's going to kind of naturally evolve over time. So I like the word alliance. I don't want to have a relationship with my clients. I want to have relationships with my friends and with my colleagues, but I want to have an alliance with my clients.
Alliance is a good word, yeah.
It's like NATO. It's an alliance of nations that have different reasons for being there, but they're all at the table because they are working together toward a common cause.
That's a good point.
Yeah. Even if their relationships are lousy.
What kind of message do you have for us here in Finland? Do you see the future of this kind of walking therapy method as a mental well-being service or something?
Sounds like you guys have already answered that question. You've been tremendously successful in the last 3 or 4 years. What little I know from the data that you've shown me already today, and what I know from the research that other people have done, this has taken off like wildfire here. It sounds like you've identified a solution, an effective, efficient, cost-effective way of providing a large number of people with services that they wouldn't ordinarily have access to. That's the real beauty of the whole concept of single session therapy. And the walk-in variety especially, is that there's a need for this service and people can't get it any other way because of all of the bureaucratic structures and the medical, the traditional medical, psychiatric, psychological approach to working with people that have problems. Waiting lists reduced, walk-ins, clinics reduce waiting lists. In many areas of Canada where they've open walk-in clinics in community mental health services, waiting lists have disappeared. People that need services didn't have to wait years and months. In clinics where you're dealing especially with children, putting a child on a 6-month waiting list when they're 7 or 8 years old, 6 months later they're in an entirely different developmental stage. The problem might have gotten worse. Remember the Band-Aid metaphor?
Exactly.
If you'd gotten that kid in for a walk-in session, put a Band-Aid on him, that might have prevented the things from getting worse that happened as a result of being on the waiting list. So the enthusiasm that you folks in Finland have had toward developing walk-in services is just amazing.
Thank you.
Yeah.
So is there some question you wish you had been asked or you would have gladly answered, but I wasn't asked that? Or something that you want to add or share with us?
Well, one thing that occurs to me is you didn't ask me if there were any theories of psychotherapy that were necessary to do single session therapy. And so one of the things that I think people don't understand about single session therapy is that it's not a theory of therapy. For instance, it's not a theory of therapy like solution-focused brief therapy is a theory of therapy. It is a perfect, solution-focused therapy is a perfect fit for single-session walk-in therapy. But you can do single-session therapy if you're a cognitive behavior therapist. You can do it if you're a narrative therapist. You can do single-session therapy if you're a psychoanalyst. Single session refers to a service delivery model, not a therapy model. So it's the idea that you're going to approach each session as if it were the last opportunity you'd have to work with this person. So you ask the cognitive behavior therapist, what would you do? And they have an answer. Well, if I only have one session, I'm going to do this. So my colleague Arnie Slive says the only theory of therapy that doesn't fit in the single session delivery model is the therapy that doesn't think anything good can happen in an hour.
That's a good answer.
Yeah.
Thank you.
Yeah.
And that's for your time also.
I'm envious, as a matter of fact. I wish we had been as successful in many ways in the U.S. as you have here in Finland in only 4 years.
Well, we have still lots work to do, but we need to be also patient. Also.
Yeah.
Thank you.
You're welcome.